Some of the non-respiratory functions of the lung are: the main function of the respiratory system is, in general, uh, is a gas exchange. Some of the non-respiratory function of the respiratory system includes the lung defense mechanism. The respiratory passages not only serve as a gas conduits but also humidify and cool or warm the inspired air to make it attain body temperature by the time it reaches the alveoli. Bronchial secretion contains secretory immunoglobulins, that is IgA, and other substances that help to resist infection and maintain mucosal integrity. Pulmonary epithelium contains an interesting group of protease activate receptors, that is PARs, which when activated triggers the release of prostaglandin E2, which in turn protect the epithelial cells. Pulmonary alveolar macrophages, which are called as PAMs, these cells come originally from the bone marrow. They are important component of the pulmonary defense mechanisms. They are actively phagocytic and ingest inhaled bacteria and small particles. They help in processing the inhaled antigens for immunological attack. They secrete substances that attract granulocyte to the lung, as well as substances that stimulate granulocyte and monocyte formation in bone marrow. Prevents foreign body from reaching the alveoli. If the particles are more than 10 microns diameter, the hair in the nostrils strain out many of such particles and they settle down on the mucous membrane in the nose and pharynx. Particles between 2 to 10 micrometers, these particles when fall on the walls of the bronchi as air flow slows in smaller passages, initiates reflex bronchoconstriction and coughing. Thereby, particles are removed away from the lungs by ciliary escalatory action. If the particles are less than 2 microns, generally they reach alveoli where they are ingested by the macrophages. Then functions of pulmonary circulation. It acts as a reservoir for the left ventricle. If the LV output becomes transiently greater than the systemic venous return, the LV output can be maintained by drawing out blood stored in the pulmonary circulation. That is only for a few strokes. It acts as a role as a filter. Pulmonary circulation acts as a filter for many substances like fibrin clots, fat cells, detached cancer cells, and agglutinated RBCs. Fluid exchange. It is important for fluid exchange and drug absorption. Low pulmonary hydrostatic pressure tends to pull fluid from alveoli into pulmonary capillaries, thereby keeping the alveolar surface free from liquids. This facilitates the rapid entry of drugs into systemic circulation, which rapidly pass through the alveolar capillary membrane or barrier by diffusion. For example, anesthetic gases and aerosols. It has some metabolic and endocrine functions. Manufactures a surfactant for local use, which prevents the development of surface tension between the fluid lining the alveoli and the alveolar air. Substances synthesized or stored and released into the blood. For example, prostaglandins, especially prostaglandin E2 and prostaglandin 2 alpha, contain a fibrinolytic system that lyses clot in the pulmonary vessels. The lungs also activate one hormone in the pulmonary circulation. Lungs also activate one hormone in the pulmonary circulation, that is angiotensin 1 to angiotensin 2 in presence of angiotensin converting enzyme. This reaction occurs in the tissues also but prominent in lungs. Note that angiotensin 1 is inactive decapeptide, angiotensin 2 pressor aldosterone stimulating octapeptide. Large amounts of angiotensin converting enzyme is located on the endothelial cells of pulmonary capillaries. Angiotensin converting enzyme inactivates bradykinin. It helps in the removal of serotonin and norepinephrine, thereby reducing the amounts of vasoactive substances reaching the systemic circulation. However, many other vasoactive substances like epinephrine, dopamine, oxytocin pass through the lungs without being metabolized.